Hello everyone, my name is Pas-arj. My advisor is Dr. Natashai Siswat. Today I'm going to talk about assessing the potential biomarkers on prognosis in dengue infection. Today I'm going to talk about 5 topics. First one is introduction, pathogenesis, clinical manifestations, proteomics, and methodology. Introduction. Dengue infection can be transmitted by female mosquitoes, Aedes aegypti and Aedes albopictus. Dengue virus has 4 serotypes: serotype 1, 2, 3, and 4. Structure. Dengue virus is in the family Flaviviridae, genus Flavivirus, and a small envelope positive sense single-stranded RNA viruses. Dengue virus has a 11 kilobase genome encoding 3 structural proteins comprised of capsid envelope precursor membrane. Non-structural proteins include 7 parts: NS1, NS2A, NS2B, NS3, NS4A, NS4B, and NS5. Pathogenesis. At the site of mosquito bite in the skin, many immune cells such as dendritic cells, Langerhans cells, macrophages, and mast cells are present. Some skin cells are the dengue virus infected target cells, including dendritic cells. Macrophages are also important in antigen-presenting cells to T cells in lymph nodes. Several clinical studies support the hypothesis that T lymphocyte activation and cytokine production are important in the pathogenesis of dengue hemorrhagic viral fever. Cytokine bombardment is usually believed to occur in many severe dengue viral patients, as many circulating pro-inflammatory cytokines, leading to vascular leakage and shock. Antibody-dependent enhancement is one of possible hypotheses proposing severity of dengue infection is associated with secondary infection of dengue virus with a different serotype. This phenomenon is related to interaction of pre-existing antibodies from the primary infection, and some of antibodies cannot neutralize the dengue virus, known as non-neutralizing serum antibodies. When dengue infection occurs with the presence of subneutralizing dengue antibodies, disease may progress. Increased capillary permeability may be due to gaps in the endothelium, and this may suggest that endothelial cells are also the target cells for dengue virus infection. In clinical manifestations, is divided into 3 phases. First one is febrile phase. Secondly is critical phase. Lastly is recovery phase. In febrile phase, patients may have high-grade fever for 2 to 7 days. It can increase up to 40 Celsius. Signs that may be found in patients such as facial flushing, skin erythema, generalized body ache, myalgia, arthralgia, and headache. In laboratory changes, It may found hematocrit is slowly increasing and platelet is slowly decreasing. In the serology and virology, it may found viremia because of the infection. In critical phase, it can be found the defervescence. It means the decreasing of body temperature. In this incident, it can cause plasma leakage and hematocrit increasing. In severe plasma leakage can cause shock, and then hypoperfusion lastly is organ impairment. In laboratory changes, it's found that platelet is steadily low and hematocrit is peaking. In recovery phase, it can also cause as reabsorption of fluid. This brings to the fluid overload. In laboratory changes can be found the platelet is increasing and hematocrit is low. In serology and virology may be found the IgM and IgG in this phase. Proteomics. Currently, there is no drug therapy for dengue hemorrhagic fever, and there are no reliable methods currently available for early triage of dengue hemorrhagic fever patients, resulting in significant over-hospitalization. Previously, numerous efforts have been made to identify serum markers that may predict severe dengue disease, with an emphasis on cytokines. Recent advances in global-scale proteomics technologies enable the detection of candidate protein biomarkers. These include proteins, peptides, or metabolites that can be measured alone or in combination and would reliably indicate disease outcome. Proteomics is a post-genomic biotechnology that has been increasingly applied to discover the pathophysiology of common complex diseases, including non-infectious and infectious diseases. Proteomics has also helped in identifying potential biomarkers for febrile infectious diseases. With the advancement of proteomics technologies, the detection of candidate protein biomarkers is now feasible. Methodology. My research design is observational study. My population is confirmed dengue infection patients who are admitted at Ban Pong Hospital and Potaram Hospital in Ratchaburi Province. Inclusion criteria is age above 15 years old and positive tested patients with NS1 antigen or IgM ELISA. Exclusion criteria is patients not identified as dengue infections. My study procedure is: first is admissions by inclusion and exclusion criteria. Next is informed consent for the patient. Next is sample collection. First is plasma preparation at the present, and additional plasma sample at day 30. Next is liquid chromatography for separations of the substance, and mass spectrometry for protein identification. Lastly, report. Thank you for listening, everyone.